everyone, welcome to today's teaching session on arterial line priming. As graduate nurse, it's essential to develop confidence and competency in this procedure because the art line are commonly used in perio, critical care and high acuity setting for continuous blood pressure monitoring and blood sampling. Learning how to accurately prime to ensure accurate hemodynamic reading, prevent air embolism and reduce the risk of infection. This skill also reflects broad nursing competencies such as aseptic technique, attention to detail, and patient safety. Today, we'll use see one, do one, teach one approach. I will first demonstrate the priming process, then you'll practice it, and then later, you'll teach it back to reinforce your learning. So before we start, let's review the required equipment. So first, we need 500 normal saline bag, and then we'll need a pressure bag as well. And then the transducer monitoring, it comes in a package. And also this is the extension line. And we'll also have some hand sanitizers and some wipes and some labels as well. So this is do not inject label, there's some arterial line sample, and then this is some dating for the arterial line. And always check expiry date, integrity of the packaging and fluid clarity before beginning the process. Okay, sure. So we'll just hand sanitize first. Then we'll just hang up the fluid first. So there's a little knob over here, and then we'll just put the normal saline over it, hang it, and then now we'll just open the outline pack. And it comes with the stopcock already, and then this is the arterial line label, so we'll just leave that one temporarily. Just open that, and then just take the cap off and take the cap off from the normal saline 500 bag. And take this one off, just spike the back, and then we'll start pumping the bag. So after pumping, just make sure we're up to 300 and then it will be in the green bar area. Now we're just priming the actual outline. So this is the knob, so you can use both ways. So you can either pull this bit up and it will start priming, or you just squeeze it like little butterfly part. So you just squeeze it and it will start priming. And I'll just prime this in the back, just make sure there's no fluid coming out. There's a few air bubbles coming out. Nice. And then there's a 3-way tap on near the transducer. So you just turn it off to the patient, and then you just make sure you prime it. So this one doesn't have a stop lock, so you will come out with fluid. So that's coming out. And then we'll just close off the 3-way tap halfway, and then it's all closed, so there's no liquid leaking everywhere. So now we'll just change it to a stop lock. So just make sure this is all clean. So we'll just open this and just carefully take the outline label out, leave the rest, and then we'll take the arterial line and just label on top of the little hub. And we'll change this, just make sure this is clean. A stop lock. And then we'll take this one off and change it to a stop lock. And we put labels on top as well, so make sure we don't inject anything into the actual arterial line. So we usually put labels up here. And this is a dating one that we usually put. So make sure we put this one on so the actual arterial line expires within 24 hours. And just put an arterial line on the transducer. Check it. And this is the full set of the arterial line. Sometimes we're required, sometimes we need an extra extension line on top of this because this part is connected to the patient. So this is a extension line tubing. So we'll just open that one up, open it. So this part is connected directly to the extension arterial line. So just make sure we're all clean. So take this cap off, remove this, and twist it on. And make sure everything's nice and tight as well on top of this as well. Just make sure nothing's doing, and then just make sure we can start priming this part. Put this stuff coming out, and just make sure there's no air bubbles on any of the lines.